Hello and welcome to 6 Minutes. I'm Gemma Collins. Patients could soon be able to get oral contraceptives and statins over the counter from their pharmacist without needing to see a GP, as part of new legislation proposed by the government. As long as the patient has already been prescribed the medication by their doctor, pharmacists will be able to continue to dispense the medications without seeing a repeat prescription. The AMA has already condemned the plans, saying it could put patients at risk. But what would these changes mean for GPs? We spoke to Sydney GP Dr. John Gullotta to find out more about it.
Well, I think the dispensing rights really belong to pharmacy, but prescribing rights belong to the general practitioner. And I think the blurring of both would be not only a danger to the patient, but it's not really quality use of medicine. Well, if a patient's going to a pharmacy and getting a repeat prescription without the doctor knowing about it, then potentially that patient may be getting something that's not intentional. So whether the dose may be changed, whether the doctor's actually stopped the medication, or whether the doctor actually wants to review the patient, that won't happen at a pharmacy level. Potentially there could be harm there, and that's why it's very, very important that the doctors at least see the patient once a year. With the current guidelines and the current repeats, up to 1 year can be prescribed. Well, I think the important issue is that, if you're seeing a patient, you obviously want to monitor the patient, especially if we're talking about cholesterol lowering or the use of the oral contraceptive. You've really got to monitor the patient for side effects. In chronic patients, in elderly patients that have got comorbidities and other illnesses, really you'd want to see the patients much more often than 1 yearly. That's one of the other things is, how often can this be continued? Can they go to individual pharmacies and get supplies, ad infinitum? And not have a pap smear and not have a breast check? Well, the risk for the GP is that obviously the GP is responsible for their patient, that they're responsible for prescribing the medication. Now, what we don't know is who's responsible for the continuance of that medication. Hopefully it's not the GP, because I would be very, very annoyed, outraged in fact, if my prescription was extended and I'll be responsible for that. It'll cause legal risks for doctors and it will cause legal risks for pharmacists. Any bad reaction would be solely on the head of the pharmacist. They would be responsible, and hopefully legally that would be the case. I think the danger is that this will be expanded and potentially it could be antihypertensives, every single medication can go on there. And really, that will I think, fragment the excellent healthcare system that we've got in Australia. So, this really is a hidden way of pharmacy prescribing. I think it's very devious, and I think we've really got to fight this because it really will cause patient harm. Pharmacists have got their role, doctors have got their role, and I think, we should be sticking to those roles rather than trying to blur them.
Well, we expect to hear more about this as these proposed plans develop, so we will keep you updated on that. And with Christmas approaching, next week 6 Minutes will be looking back on the year to see which health stories dominated 2011. I'm Gemma Collins. See you then.